Welcome. My name is Martin ROOSLI. I'm Professor for Environmental Epidemiology at the Swiss Tropical and Public Health Institute. It's my great pleasure to talk today about noise pollution at the second Global Conference on Noise and Health. My talk is about global burden of disease. So you would expect to hear at some point in this talk some numbers, what is the global burden of disease? But unfortunately, I have really to disappoint you in that respect. I will show that basically such numbers are not available, and that is really an issue and a problem for the global awareness about noise pollution and in particular transportation noise as a public health problem. Actually, I would say noise on a global scale is like a neglected disease, a neglected exposure, and we should make ways to change that. So let's first look at the number of noise research published every year. And as you can see, it's still quite a relatively new field of research with recently more publications coming out. And you may say 1,600 papers, this is quite a lot, but just in comparison, for instance, with air pollution research, you would see there would be 20 times more paper about air pollution and health. So this just shows how little research on noise is done comparatively. And if you look, where is this noise coming from? Then you would realize that most of the research is coming from Europe, with Germany, England, Netherlands, Spain. Even a small country like Switzerland contributes quite a lot to noise research. And then there's only a few other countries outside Europe contributing to noise research, like the US, China, Canada, Australia, and also India or Brazil. But it's really clear, and also South Korea here, but it's really clear that most of the research is from Europe and that we know quite little about noise problems outside of Europe. And this has consequences. So if you go to the global burden of disease and look what are DALIs attributed to different risk factors, we see that for particulate matter is actually at the second highest point. So this is very relevant for health on a global scale. We see other environmental factors like unsafe water, low temperature, lead, occupational noise, or high temperature, which are also ranked here. But we don't see environmental noise or transportation noise listed here, which certainly does not reflect reality. It must be very clear for everybody that transportation noise is a relevant health risk on a population level. So let's look in India. How does it look in India for the environmental risks in 2019? Just environmental risks. So we see on the first place particulate matter, followed by unsafe water, unsafe sanitation, lead, hand washing, occupational injury, and quite low, we also see occupational noise ranked in this list. So what are the noise effects on the body? There's basically direct and indirect effect, and the direct effect can be like the sleep disorders, and the indirect effect is the stress that is caused by noise, also leading to anger and annoyance. And all these effects then are stress for the body, risk factors like blood pressure, blood lipids, blood viscosity is increasing. Also factors related to the metabolism, and there's now quite some evidence that metabolic syndrome and cardiovascular diseases are in the long term related to noise exposure. It's also clear that noise that leads to sleep disorders may have some consequences in the long run, as it is well known if you suffer from disturbed sleep, this will have an impact on the food intake, and also the motivation for physical activity will change. So again, both risk factors for the cardiometabolic effects in humans. So let's just showcase a little bit of research that we have done in Switzerland on this subject. We use data from the Swiss National Cohort Study, which is a nationwide cohort, and analyzed 172,000 cardiovascular deaths in relation to noise. So we had a nationwide noise model, predicted noise for each apartment at several points of the apartment, looked in the period from 2000 to 2008. And as you can see in red for road traffic noise, in green for railway noise, and in blue for aircraft noise, there's a relatively consistent exposure response association between the risk of dying from myocardial infarction and the corresponding exposure source. There's no clear threshold. It really starts at relatively low level of, let's say, 40 to 50 decibels, LDN noise levels. In another study, in the so-called SAPALDIA study, we also looked into diabetes. It's a prospective study, and we looked in 110 new cases of diabetes between 2001 and 2011 that occurred in 2,631 persons. A lot of additional factors were taken into account in the analysis, so that we can be relatively confident that we have considered the most relevant confounders. And in particular, the road traffic noise, we see a significant risk with diabetes. And as you can see from the plot on the right side, it's basically, again, more or less linear. There's no obvious threshold of no effects for that association. Just try to move to the next slide. So now let's see these results, what they do, what do they really mean? So that is, we need to go and calculate the health impact or the burden. So we have to know how is the population exposed, how is the exposure outcome associations, like the examples I've just shown. And if we combine that together with the disease rate in the population, we can estimate the burden of disease, or even calculate the DALYs and years of life lost, or the monetary value of these diseases. We have done such an exercise in Switzerland and have compared years of life lost and morbidity cases attributable to transportation noise and air pollution, and then also calculated the corresponding costs. And what you can see from that exercise is basically that air pollution causes every year in Switzerland external costs of 4 billion Swiss francs and noise costs of 2.7 billion Swiss francs. So air pollution is certainly very relevant, and as also expressed in the global burden of disease project, is an important factor for the public health on a global scale. But already this number here shows you that also transportation noise is very relevant compared to air pollution. So noise really matters for public health. And this has also just been demonstrated and showcased in a report for Europe, where they have calculated the burden of disease for the European population. On the right side, you see a map of the exposure levels, and you clearly can see in these urban areas of Europe that noise levels can be quite high, even above 70 decibels. And based on this exposure distribution, the number of people being annoyed from transportation noise was estimated to be more than 21 million people, more than 6 million people being sleep disturbed, and ischemic heart disease every year are expected to occur in 48,000 persons, and 12,000 would die every year. So this report concludes that at least 20% of the European population live in areas where traffic noise levels are harmful to health. And they also clearly state that these health impacts are most likely underestimated because they is based on old evidence. And new WHO evidence would suggest higher numbers. So let's look at these new guidelines which are made for the European region from WHO, still not for the global region, which I think is a problem. And what they suggest in this guideline, the expert group, is nighttime guideline levels between 40 and 45 decibels. And for LDN, the levels would be for road and railway for 53 and 54 decibels, and for aircraft noise, 45 decibels. How does this compare with actual exposure situations? If you look in Switzerland, and Switzerland is really not a very noisy country, usually a lot of students from all the world visiting us and coming to us are always surprised how quiet it is in Switzerland in general. But even in Switzerland, you would see that about 50% of the population is exposed to higher road traffic noise levels than what is suggested in the guidelines of the WHO. So let's come back to the questions, the global burden of disease, and why do we don't have such numbers? I have once inquired why this is not calculated. And the answer from the Global Burden of Disease project was, the problem is that we don't have noise exposure data on a global scale. So this piece is missing to calculate the global burden of disease. And I assume that this piece is partly missing because there's still this thinking that maybe in some cultures, noise is not a big issue. It's more something for the European or the Americans. They are disturbed by noise, but not other people in the world. So I have quite some collaboration with South Africa, where I'm a co-chair of Global and Environmental Health. So we wanted to have a little bit a closer look whether this statement would be true for South Africa. So we have measured noise in different areas, mostly informal settings in South Africa. So these are these 4 different areas. Here in yellow, you see the noise meter. And here on the left side, you can see the noise levels that we have measured. Typically, LDN values around 60 dB, but could also be considerably higher in these 4 areas. We have then made the same survey in a sample of South African participants. So these were parents from an adolescent study that was ongoing in that area, and asked them, how annoyed are you because of noise? And here are shown the results for road traffic and for neighborhood noise. And the darker bars are for South Africa, the lighter bars for Switzerland. And you can clearly see that basically the level of annoyance is even higher in South Africa than in Switzerland, which is not a surprise because the measured levels were also higher than what we have typically in Switzerland. But even if it comes to noise sensitivity, which is more a trait than reflected in the exposure situation, also here the proportion of people claiming to be sensitive to noise was higher in South Africa than Switzerland. So this survey could certainly not confirm that noise is not an issue outside Europe, or let's say specifically in South Africa. So to conclude, I think it's very important that we follow the environmental health cycle or the public health cycle, that we do environmental exposure assessment, that we do studies on the health effect. And finally, we should really calculate the public health risk assessment, calculate global burden of disease, because this really raises awareness and then will guide the environmental policies to take the adequate measures to prevent diseases from that type of exposure. So this is clearly shown in this type of public health cycles, which I strongly recommend to make available also for noise research and for noise in general on a global scale. So to conclude, I am quite convinced that community noise and transportation noise is likely to be an issue all over the world. And of course, cultural diversity may play a role. Different culture may handle noise differently. But we also have quite some good evidence from research that physical reactions occur despite adaptation or lack of annoyance. So we have nowadays quite good high health impact assessment in Europe, showing that this is relevant, that noise is relevant, but we lack such data from other countries, which is really important to generate. So that is my conclusions, and we should work to change that. At the moment, noise is a neglected topic in global health, and we need to quantify the global burden of disease for noise to raise awareness about these important public health problems. Thanks a lot for your attention, and I wish you further a very good meeting and inspiring talk. Goodbye.